One time I got COVID back in 2020 and I was like, OMG, this is the worst, but also I'm 21 years old. It should be relatively okay. I've never had any prior health issues. But then I started getting numbness in my hands and my forearms, along with really persistent headaches, which I never really had before. I attributed this to just being really stressed out because I just started the serving job. I was crying in the walk-ins. You guys know how it is. Yeah, you know how it is. But then my tongue goes numb in my mouth and I'm like, that's not supposed to happen. So I go to the ER, I pass out in the ER, drama queen, I know. They tell me, don't even worry about it. You're just anxious. Like they were agreeing with me. I was like, I knew it. Like, so sorry to waste your time. I go back home. 3 months later, I'm hanging out with someone. My entire left side of my face starts to droop. They're like, okay, time to go back to the hospital. I'm like, no, it's just anxiety. Don't you worry. But sadly, not anxiety, it was a stroke. And I had been having strokes, apparently, because my internal carotid arteries were closing up to be this teeny tiny small. So they had to open them back up with stents. And I was like, great, okay, that's totally great. We're done. Haha, that was traumatic, putting that in the past. I fly to New York City because what else am I supposed to do? And then whilst in New York City, I get numbness again, this time in my head, and they find a big old marshmallow of inflammation behind my eyeball. So I go back home because no way I'm dealing with that by myself. Absolutely no way. In New York City, are you kidding? And when I wake up from the flight, no vision. No vision at all. So that's kind of unfortunate. And now it's 2023 and no one really knows why all of this happened exactly or how to get rid of it.